There's the question, after testing negative, when should we do the vaccine? Okay. Ma'am, there's a question on the screen, and one of the clients is asking me, after getting the negative thing, after when you're COVID-19, when should we get the vaccine done?
Minimum 3 months. The gap.
Okay. Minimum 3 months.
Minimum is 90 days.
Okay. After 90 days, you should get the vaccine done then.
Well, yes.
Okay. Second question which is come up is,
sorry?
Can vaccine be taken during the periods?
Definitely, yes. This question I'm being asked so frequently. And I don't know why this myth is there. Vaccine can be taken during any phase.
Okay. Ma'am, menopausal, the females who are having their menopause, they're having a lot of issues with their health and they're not able to fight over it. Can you tell how can they do it? Because they're having a lot of stress, a lot of anxiety and the hot flushes. How can they face that? What do you suggest to them? Because they're not able to visit you also.
Well, the problems that menopausal women face more frequently are the hot flushes and the genitourinary symptoms like vaginal dryness or urinary complaints. Those are the most common symptoms. And the other symptoms we are seeing these days because of the pandemic, because of the lockdown going on, lots and lots of women are complaining to us of difficulty in sleeping. They have sleep disturbances, they have mood swings, they have more fatigue, along with all the symptoms that I already mentioned. And I do come across women who are complaining of a decreased sex drive too. And they are facing these problems more during the pandemic. Because of the lockdown being going on, they are confined inside the house and they are facing these problems more and more. Well, they need not suffer. They should get in touch with their doctor. They should do a teleconsultation. All these problems are treatable. They are very much treatable by medication. So postmenopausal women need not suffer anymore. Initially, women used to think that having these problems is normal. It is not normal now because life begins after the age of 50. So if you are suffering from these problems, your quality of life goes down. So please get in touch with your doctor. Medication is definitely going to help you.
Okay. And there's one more question on the screen, and this Komal is asking me that because of hormonal issues and my weight is stuck, because people have this thing like PCOD and hormonal things get the weight stuck. So should they go for insulin resistance and the supplements like vitamin D, B12, calcium? How far are they good, and should they go for that?
As far as PCOD is concerned, it is basically a hormonal imbalance wherein women face insulin resistance and there is more excess of androgen. So these women tend to gain weight. They have irregular periods and they have androgenic symptoms like acne, excessive hair growth, pigmentation, and a lot of women face fertility issues too. So this is a whole spectrum of symptoms that a woman faces during when she has PCOD. Well, controlling the diet, lifestyle modification, doing exercising, and losing your weight is the key to success in any patient who's suffering from PCOD. A lot of women, when they lose weight, they conceive spontaneously.
Right.
Especially those cases. Sorry?
I've had so many cases. They were going through the diet and they lost weight and they could conceive.
Yes, because a lot of women who come to us with infertility problems, who have PCOD, the first thing that we advise them is to lose their weight. So losing weight by exercise and by diet control, it definitely helps them with their symptoms.
Right. Ma'am, are PCOD women more risk to develop diabetes during pregnancy or diabetes later on in the life?
Well, yes. If you have PCOD, you are more prone to develop gestational diabetes, that is diabetes during pregnancy. Because majority of the time, the women who have polycystic ovaries, they are obese. And they have insulin resistance and they have more level of androgens, which makes them more prone to develop diabetes during pregnancy. And these women also have a family history of diabetes. If you have a family history of diabetes, you are more prone to have polycystic ovarian disease. And it is true vice versa too. If you have PCOD, you are more prone to develop diabetes later on in life. So controlling your PCOD is very important. And controlling your weight by whichever means is the mantra for controlling PCOD. Apart from the medication, of course, apart from the
Right,
medication.
medication is important. So I think if somebody will come to you, you will put the person on insulin regulator. So basically a low carb and low sugar diet, a lot of fiber is important.
Yes, well, there are a lot of treatments available to control PCOD. So apart from our medication, which helps them with their weight loss, which helps them with their androgenic symptoms that they have, because a lot of women come with their facial hair and acne and excess pigmentation. With treatment, all these things are treatable. And as I said, weight loss is the key to success.
Perfect, ma'am. Ma'am, now what I'm going to say is women are not able to talk about it openly. That's the breast pain. Because it's India, it's like, shh, okay, so we don't talk about it openly. But what happens is when the breast pain happens, they actually in the mindset, the fear of breast cancer. So that's the thought which happens. So what about that?
Well, not every breast pain means breast cancer. Breast pain can be there because of various reasons. It can be there because of physiological reasons, like many women get breast pain premenstrually. Then getting breast pain during pregnancy and lactation is normal. The breast pain can be after a vigorous exercise. It can be because of injury. It can be because of some infection. Not every breast pain means cancer.
It can be because of the chest exercises. Maybe they've overdone it, or after such a long time, they go into the gym and they've done it.
Even because of wearing a wrong size of bra.
Yeah.
Women face these problems very commonly. But if you have a sharp localized pain, there are more chances of it being cancerous. Localized pain goes more in favor of a cancer, but not always. So better any kind of pain that you're feeling in your breast, please get in touch with your doctor. After taking your history and after examining you, the doctor may advise you to go ahead with either a mammography or an ultrasound of the breast or an MRI of the breast.
Right.
So one need not be scared about the breast pain, because breast pain is a fairly common symptom. And the most common problem that causes breast pain is fibrocystic breast disease, wherein your breast develops cysts, and the breast becomes lumpy and painful. It is 100% benign disease, and it is very much treatable. So there are women who face continuous breast pain because of fibrocystic breast disease. It is an absolute benign condition. It does not predispose you to breast cancer, and it is very much treatable. So one need not be scared of the breast pain. Please seek treatment for that.
And ma'am, what about the breast lumps? Do we need to worry about it? Like if you find a lump in the breast, is it a thing to be
It is
worried?
common to see lumps in the breast. In younger age group, we see a particular problem which is called fibroadenoma. Again, fibroadenoma is almost like developing fibroids in the uterus.
Okay.
So these are fibroadenomas are benign tumors that develop in the breast, and we commonly see them in younger age group. So not every breast lump is a cancer, but having said that, if you are feeling a lump in your breast, please don't take it for granted that it is going to be. Please get in touch with your doctor, especially because if a lump is freely mobile and it is moving when you are palpating your breast yourself, because we always recommend that you should do self breast palpation with the flat of your palm. You should palpate your breast while taking bath in the morning. Every 15 to 20 days, just feel your breast with your palm and try to see if there is any lump in the breast or not, especially those women who have a family history of breast cancer. They should keep on palpating their breast on regular basis to see if they can feel any lump. So the first signal you will get that if you have a lump in your breast, well, whether that lump is a benign lump or a cancerous lump, your doctor can decide better. But mobile lumps are majorly fibroadenomas. But when you have a fixed lump, which is not moving beneath your hand, and it is firm and irregular, and it is fixed to the back of your chest, there are more chances that it could be cancerous. And if along with those lumps, if you see that your nipple is retracting nipple is a very good sign of telling you when there is something wrong. Or if you are getting some bloody discharge from your nipple, that again goes in favor of the higher probability of it being cancerous. So fixed, irregular, firm lumps with nipple retraction, with or without a nipple discharge, be alarmed about it. And if you have a strong family history of breast cancer, please get in touch with your doctor for getting your breast examined at frequent intervals.
Ma'am, there's a myth also that women who wear the wired bras, they have more chances of developing breast cancer. How far is it true?
Not really. Not really. Wired bra has nothing to do with breast cancer. Well, that can happen, that if you are wearing a very tight, ill-fitted bra and it is giving a constant pain to your breast and a constant friction is there, that is giving you symptoms of breast pain and all, that may be there. But it
Right.
causing breast cancer, well, there is no truth in that.
Right. Ma'am, as we all know that health of a woman is health of the whole family, and she is the one who takes care of so many. She is basically a multitasker. She has to do so many things. So what do you have to say about it? Like, now we have started adapting the Western culture in India. There is a shift of thought. So what do you have to say about the lifestyle change? Because the COVID is not going to end. It will take some years for it to end. So what do you suggest the Indian women to do in their house to teach their children, to teach their family what lifestyle change, healthy eating, balanced diet, how important it is? I think if we teach in women, we are teaching the whole family.
So true. It is very important for women to be healthy themselves. A healthy woman can ensure a healthy family. So women have to first look after their own health. So if they are facing any physical or mental issues, they should immediately get in touch with their doctors, take treatment for that. And even if somebody becomes COVID positive in your house, you need not panic. You can plan out the things, because the whole burden comes on a woman to look after a person, a family member who's suffering from COVID, to look after her children, to keep them separate, to ensure a healthy diet, to do household work, plus the economic burden that has come.
Right.
So many people are losing their jobs. The husbands are losing their jobs. So that economic burden as well is creating a lot of anxiety and stress. So that is adding on to their problem. So women need to exercise regularly. They need to do pranayams or some breathing exercises to calm their minds. If they are facing certain issues, please get in touch with your doctor. Doctor can put you on medication which can help you to allay your anxiety. And if you are healthy yourself, only then you can ensure a healthy family.
Right, ma'am. So, but antidepressants should not be taken, right? Because people, what they're doing is they go for antidepressants very fast, and then they gain up very fast. Like weight gaining tendencies more. So I think they should do little home exercises, pranayam, and eating things like dark chocolate at it, as it helps to calm the brain. They should try to do all these things.
Well, as far as antidepressants are concerned, they should not start it themselves. It has to be taken on medical advice.
Right.
Antidepressants one should not take just over the counter. And they
It is
should
now accessible to Google and YouTube is like, and WhatsApping. People find it more comfortable. So I think they have to take advice of experts like you instead of taking it on their own.
they should get in touch with their doctor if they are facing any mental issues. If the doctor has to decide whether they need any kind of an anti-anxiety or anti-depressing drugs, the doctor has to decide that. They should not be taking the medication on their own. And if your doctor thinks that taking an anti-anxiety or an antidepressant drug is going to be helpful for you, taking it with medical advice, maybe for a shorter duration, or if the doctor feels that you need to take it for a longer duration, please follow your doctor's advice. You need not be depressed all the time, because these days we get a lot of distress calls. Women
Right.
are depressed. The problems they were facing earlier, those problems have become more aggravated because they are depressed.
Right.
So seeking the medical advice is definitely going to help you. So if you help yourself, only then you will be able to help others.
Right. So thanks again, Dr. Vishakha Minjal, for coming up again. Thanks for your knowledgeable advice and giving your precious time. Thank you very much.
Thank you so much.